All right. Everybody can hear me okay? I think we're the last couple speakers before the reception, so we'll try to limit it to 1, maybe 2 hours tops, so, so we can get out of here on time.
Yeah,
So
we'll
anyway, I'm going to introduce myself. Let me see if this works here. There we go. So there we go. My name is Risheet Patel, and I'm actually a family physician here in Indianapolis. I finished training about 11 years ago and worked with one of the hospital networks here for quite some time, but decided that DPC was the way for me. So last year I opened up Fisher's Direct Family Care, and I'll let Brad introduce himself.
My name is Brad Banks. I'm one of the co-owners of Banks & Brower, which is a local law firm, and we use Dr. Patel's services for our employees.
Well, great. So I think this will be an interesting talk after hearing a lot of what we've heard earlier today about how to work with employers and some of that data and type stuff. So just really hearing it from Brad himself of kind of how we found ourselves. Here's our learning objectives. I just have a couple slides. We'll scroll them along while we're talking just so you can kind of highlight some of the topics that we're going to be talking about. But Brad, if you just want to start with, I know I've known you for a few years now, but last year as you were looking and you found our practice, what was going through your mind of what you're looking for or what you were facing with your employees?
Sure. We've got approximately 13 full-time employees, several of which are single individuals. We do have some people that are members of families too, and we were trying to figure out an affordable way to help them with their health care. For a business our size that has just 13, 14 employees, it's very difficult to be able to afford a full health care plan. It's not just difficult, it's really almost impossible. And so I was actually previously had been a patient of Dr. Patel's before he went off into this world. So I had seen an article about the business in the local Fisher's newspaper, and just sort of was intrigued by the idea. Didn't even know this world existed, quite honestly, and thought, well, this seems like a pretty neat opportunity to provide something extra for our employees that would be potentially at no cost to them, and something that we could provide as a benefit. And so we decided to take a look at it and enroll in the program.
So what were your employees doing prior to this? Were they just on their own finding benefits, or what were they doing?
Yeah, I would say I believe as we're currently situated, my business partner and I are the only two people that work that have full insurance through our spouses. So we didn't need insurance ourselves. I think everybody else that we have was buying plans through the individual healthcare market. We did find there's another program that we utilize that's called Gravy, spelled Gravie. It's a program that allows you to reimburse your employees through their pay for part of their healthcare costs that they're getting through the independent market. Because the way the statutes are written currently, you're not allowed to buy healthcare plans off the individual market for your employees. But there is a process that the IRS has approved where you can reimburse them for part of those costs. But all of them are carrying very high deductible, expensive healthcare plans that until they have something catastrophic, really, it's not going to provide much of a benefit to them. And this at least seemed like a way to help fill that gap in part. And everything I'm hearing so far is that they really appreciate and enjoy the benefit.
Well, great. So you're a patient yourself, obviously. Hearing from your employees, were you hearing about the frustrations of that type of thing, the high expenses, maybe long wait times to get in to see a doctor? Is that something that you were hearing from your employees prior to joining our practice?
Yeah, I think the thing that's probably most scary about what was happening before is that most of the time they were just not going to the doctor. They literally were just choosing not to go get health care because of how expensive it was, and including and this is sort of a long drawn-out story. We had an employee ended up having a very complicated medical situation. She didn't go for over a month, and she was very sick by the time she went. And despite, you can't force people to do things, but we were definitely encouraging. That was before we had this program in place, and it's definitely not that way anymore. I mean, they're catching a virus, they're going to see Dr. Patel as opposed to just sitting and spreading it amongst all the employees, which is what was happening before, literally. So that's what I would say is the biggest change is that, and it's sad that we're in a situation where people are choosing not to get health care because of it being expensive. But that's, having this, at least they get a place where they can go and see, you know, how serious is this? Is this something I need to be paying more attention to or not?
Sure. So I think if we look at our slides, some of the advantages that I think you've highlighted on some of those, definitely the cost of, you know, we're getting high quality primary care at a fixed cost. One of the things that we try to do, because we do use a lot of telemedicine and e-visits, is to reduce some of that employee absenteeism. So sometimes simple things that an employee may have, you know, in the morning when they come to work, if we can handle it by an e-visit, they don't have to leave work. Have you been seeing that you know, maybe you're not seeing as much sick days or time off taken to go to the doctor?
Yeah, it was funny because I actually, had a little bit of break in the day this afternoon, and so I was asking my employees, were they enjoying the service, because I knew it was coming here. And I didn't know that they had used it really, and it turns out like all of them have used it. And so apparently, yes, because I haven't noticed they aren't at work. And so they all, like, I said, give me a scale of 1 to 10 how you're enjoying it. And they all said 10. And so, and every single one of them that are enrolled, and I think now, I think all of our full-time employees are enrolled in the program. They had all used it at some point, and some of them have used it over the phone, and some of them have come in for actual appointments, from my understanding. And they definitely see it as a very positive thing.
Well, that's good to hear. So going on to the third thing we have there is a perk to attract and retain employees. Is that something you've had challenges with? I'm sure, let's say, larger law firms here in Indianapolis have the ability to provide full benefits and packages. Is this something that you've used to help attract or retain those employees?
Yeah, absolutely. Probably the number one thing that we have as a downside, because we offer retirement, we offer a 401k plan, we do all the other stuff that you want to be able to do as an employer for your employees, is that we don't offer a full health insurance package. And so we use social media and Indeed to advertise our positions. And it's been interesting because in the last couple of jobs we've posted, we have listed this benefit in our job listings. And what's been most interesting is I've had fellow small law firm lawyers send me messages and say, what's this doctor access you're providing your employees? We want to understand more about that. And with the way we sort of market is we compare it to, I think people can relate to, like the government, Marion County government, or Fishers, the state of Indiana. They have the clinics where the employees have access to the clinics at no cost. We sort of relate it to that as how we explain it to future or potential employees. And yeah, it's generated a lot of discussion on Facebook, especially about what is this, how does it work, and I found that very interesting because I think a lot of people are like me and they just didn't know of the options.
Sure. So I'll go into a little bit about what we did for you when you approached us last year. We obviously talked about your employees and the size and getting you guys set up on a monthly fee to kind of cover your employees. What I wanted to do off the bat was provide something on site for you guys to get all of your employees essentially registered. I'm sure state regulations may vary a little bit, but in Indiana, to be able to do the full scope of telemedicine stuff, I need to see a patient at least once face-to-face. So I actually went on site and did little intakes with all of their employees. So literally on day one, we were able to use all of the telemedicine services to be able to handle that. Ultimately, for our patients that we enroll in the office, we would see them then, and then they would have access to that. So I wanted to make sure that, on day one we had that ability, so we came on site to do that little intake, and it was very brief. We just got medical histories. I just checked some quick vitals on people, and that was it. But now they became an established patient, and I was able to handle all of that. We also did a flu clinic on site, I think it was last November when we had our flu vaccine in. So I don't know if that was a benefit, if your employees enjoyed that, or I don't know how many got flu shots. I don't want to say we forced flu shots, but we kind of forced flu shots on them. But I don't know how many those would have gone on their own to get their flu shots done, but we came on site and did that. So
yeah, I know the feedback was fantastic. All of the employees were excited to be able to walk 15 steps, get their flu shot, and go right back to their desk and not have to not have to expend their funds to take care of it. So they enjoyed that. Some of them some of our employees have some pretty kooky sense of humor, so they were making fun of some of the things about seeing the doctor in the office and making jokes out of that. But it worked really well. Everybody seemed to really enjoy it. And I think everybody that could or was a part of the program took advantage of it.
Sure, absolutely. The other thing that working with small employers we can do, I don't know that in talking with your employees or yourself that you have any of these, but some employers may have some unique healthcare needs. So I think of, let's say, an employer that has a lot of drivers, commercial drivers, and they need regular DOT physicals. I've worked in the past with an employer who a lot of their employees traveled internationally quite a bit. So they just wanted to know every time the employee traveled, are they up to date on the vaccines that were needed? Are there medications that they could take with them while traveling? So we would kind of be their point of contact for that. So I think that's something, I don't think that anything has come up with our relationship, but that definitely can be an advantage of having that as well when you have kind of a go-to place to send your employees to get some of those things taken care of. And then finally, I know we've talked briefly about this, and we've had some talks earlier today about this, about how can having a DPC membership potentially save if you are offering insurance benefits. And I think you're looking into that. Is that correct?
Yeah, that's correct. We just recently became aware that there are some insurance plans that are working with DPCs specifically, and it's my understanding, at least, it's helping in the premiums that the employer would have to pay. So we've just filled out the whole roster of paperwork that you have to fill out to get quotes for all that. Excited to see that, because through the Gravy program, we're already reimbursing most of our employees $300 a month for their individual plans. So I'm sort of excited to see what the comparable will be in terms of cost. And if it's even in the neighborhood, it would be something I would definitely be interested in. And I think probably the misinterpretation is that business owners want to do everything as cheap as they possibly can. But the one thing that, especially in today's market where you're employing millennials, and no offense to any of you out there that are millennials, but it's extremely difficult to keep you happy. And it's extremely difficult to keep you in your job.
Yeah.
So we are trying to be creative and think of ways that we can make ourselves more attractive and more competitive than our competition.
Yeah, definitely. With unemployment rates at record lows,
Yes.
it is, you got to keep those employees happy. So I want to talk a little bit briefly on my side, so you can have a moment to yourself there, about what is the benefit to me as a DPC physician to have a small employer to work with. And I think everyone has their own thoughts of whether you want to work with small employers or employers at all of any size. And I think one of the things that my focus when I was talking with Brad and as we've worked with other employers is I really don't want to change my practice. I have a way that I like to practice medicine, the way I like to embrace technology. We do a lot of the e-visits and telehealth, that type of thing. And I didn't really want to change that. So as we work with employers, I wanted to find a way, how can I get them to fit into my practice and provide value, as opposed to having me bend over backwards to do what they want as an employer. So that was one of the things that I wanted to focus on. But I think as an advantage last year as a growing practice, signing up an employer is kind of a bolus of patients, if you will. So, we're all used to signing up the families, one here, two there, but having a large number just kind of show up at once is a great thing for a growing practice. Helps kind of validate the model, helps get my staff. I have one nurse to help her kind of get her, make it feel like she's coming into work for some reason every day as we're starting to see more patients. So that was a good thing. Similarly, there's always a potential for additional patients, and this varies by employer. So you cover your employees, but don't cover any of the dependents or children. So, but that's always a source. Once the employee comes and becomes a part of the practice, they realize, taking their spouse or their child to their traditional fee-for-service doctor, they see the shortcomings, and if they're willing to then pay out of pocket to then sign up with us as an additional family member, that's another great source to build patients in our office with. It increases brand recognition in our community, so just having that many patients, and we'll talk about this in a second, but spreading the word amongst your business colleagues about our practice and what we do and how direct primary care works has been a great thing to just increase the awareness of direct primary care. We've had several questions in other sessions today about how do we just get people to realize what direct primary care is. And so the more people we can get enrolled in our practices, talk to business owners, that's going to get the word out about how do we, what direct primary care is and what can we offer. The other thing that I thought was really interesting is ways, as you bring employers on, to fund some practice enhancements. I think we're all, we've got our models of, we've talked about it here in the last session, of kind of keeping your overhead low and kind of really being lean when you first start. But everyone has ideas of these are things that I want to add to my practice, or equipment that I want to buy, or services that I want to provide. But until I have enough patients, I can't do that. So it almost becomes like a chicken and an egg thing. So having a small employer bring a handful of patients all at once sometimes can let you fund some of those things that you want to do. So when you guys first joined, we didn't have an EKG machine. I just didn't have enough patients yet to justify that large purchase. But then as you guys signed on, that kind of gave me the funds. So now we have an EKG machine. Not that you guys have all needed it, but we have it. Same thing happened earlier this year as I was contemplating dispensing medications out of the office. I was looking at, I need to have enough patients in the office to be able to justify going through that. It's not expensive necessarily, but it's a little bit of legwork to get that organized. So as you bring in another employer that has a handful of patients, that is able to fund that ability to go, okay, I can now have enough patients to start dispensing medications, and I'm going to start doing that out of the office. So it really can help from that standpoint to kind of fund some of those things, or just kind of take you to the next level in your practice to be able to justify some services, equipment, expenses, things like that. So those are definitely a lot of benefits that I've had and enjoyed with you and some of the other employers that we work with, and look forward to doing that moving forward. So kind of last thing I want to talk about is, so how do we find these employers? How do we engage people and get them here into our offices? So one is really just looking at our existing business contacts. As I was setting up the practice, you have like an accountant that may help you with your accounting stuff, your HR people. You may look at some of the vendors that are next door in our our exhibit hall of kind of software vendors, suppliers, things like that. Just in talking with people, it's amazing how much people don't know about direct primary care. So this is a true fact. It wasn't an employer, but the person that came to set up our HR, and I was given we have one employee, so it was not a very complicated process, but we spent much more time talking about how direct primary care works, and he actually signed up and is a patient in our office now, because he had no idea this existed and loved the concept. So yeah, we finished our HR stuff, but then he said, can I come in tomorrow for an appointment? And I said, absolutely. So just talking to people, and I think that's some things that have been highlighted today, of just getting the word out about what direct primary care is definitely is a way of getting new patients or new businesses. I signed up for our local Chamber of Commerce, so that's something that's been mentioned as well, and I highly encourage that. They have a number of events, luncheons, after hours sessions, actual business expos. So I've been to those, and I've gone for both ways. So sometimes when you're talking to a smaller group of people, you kind of highlight direct primary care at the patient level. You have some business expos, or so at that point I try to push the employer side of working with the direct primary care practice. And I think it just takes some time. This concept is new. Almost every time I go to one of the chamber events, I talk to people and they have no clue what direct primary care is. But you keep going back, keep educating people, and eventually that word will get around, and you'll start to get some results from that. Community events in Fishers, which is just a suburb here of Indianapolis where our practice is. They have a farmers market, so we have done several farmers markets this summer, last summer, out there, just talking to patients, talking to people walking by, and everybody wants free stuff, so I highly encourage, if you're doing something, have something to give away, because half the people will just want that and want to walk away, and that's fine. So make sure it's logoed so your name is on there. But that's another way just to kind of get engagement in the community, to figure out what is our office, how are we different, and what do we do. And then looking at our current patients as well. So we our current patients that maybe not through an employer, but are just there, have signed up. I sometimes talk to them about, what is your situation like at work, and what's your employer like? And so this may not apply to the people that work in a large 1,000 employee corporation. But if I find, hey, you work for a restaurant, or you work for something where you are a 5 or 10 or 15 employee organization, I have a flyer ready to go, hand it to the patient, and say, hey, just take this back, give this to your boss, give this to your person that does your hiring, or whoever it is, and see if this is something that might be interesting to them, to say, you enjoy this. Do they want to work at the employer level to provide this to all of your employees? So that's just another way to kind of get the word out there. And so I want to come back to you. You had mentioned about some of the other kind of business colleagues, other lawyers that you have worked with that have asked about this. Is this something you guys talk about at, let's say, at your level, if you're at a law conference and you want to talk about how do we keep your employees happy?
Yeah, sure. I think that I think our profession is not particularly good at employee benefits, quite honestly. But I think of the Facebook response that we got. Well, several of those were fellow lawyers who contacted me to ask about it. I get asked about it often enough that I actually have one of Dr. Patel's pamphlets sitting on my desk because I can't remember information that off the top of my head. And just in the last 2 weeks, I've been asked two different people for the contact information. One was for a soccer club. I used to volunteer on the board, and they're looking at doing something for all their employees who are all, without any benefits at all. Yeah, I think it's something I like to share with people because I really don't think people have a good understanding of what it is or that it's even out there. I didn't, and so once I saw it and saw the value of it and the value to my employees, it's something I've tried to spread the word about because I think it's a really easy benefit to give your employees that's really appreciated. And I think in our last Facebook ad we had all our little benefits of paid vacations, retirement, and then I think the way I worded it was access to general practitioner at employer cost, I think is how I worded it. And the very first response to the posting was another attorney who said, "What's this doctor you're giving your employees access to?" And so, yeah, I filled him all in on it. And then I literally had 2 or 3 other attorneys ask the same type of question. So, yeah, I think that's, from your guys' perspective, they're looking to grow your practices, I think a really good strategy.
Well, great. Well, that's what we have prepared, but we have quite a few questions, so I think we'll delve into some of these and talk about that. So the top question here is, did your employees give you any pushback about switching to Dr. Patel and myself rather than choosing their own doctor?
Yeah, I think I was thinking back through that. I know I do have one staff member who is not in the program, and it was for that exact reason. She has health insurance through her husband, and just was comfortable with her current primary care physician. So no, not other than somebody that just didn't take advantage of it. People asked questions about, who is he and how do you know him and why did you choose this care provider? But other than that, I don't have anybody that was expressing concerns about not being able to go pick their own because it's free to them, and I think they see the benefit of what they were doing, which was just paying everything out of their pocket.
Yep, and I think the fact that they're not required to see me,
right.
You have I don't want to HIPAA violate, but there's a few of your employees that essentially can use our office as an urgent care.
Yep.
So they may call us when there's an urgent issue or something they want to handle quickly, but they may still have their other existing relationship with the PCP, which that's totally fine with me. I think there's value in that as well, and maybe over time they may want to switch, but that's they're not required to use me exclusively.
Yeah, and I know one of our attorneys is married to an attorney, and I'm sort of proud that she works for a firm quite a bit bigger than ours, and she uses the services of this program because her husband has it. And so, and I think that's both of them sort of are using it from that perspective. Especially the younger employees, they like to just have somebody they can go when they're facing an illness or have a regular prescription they need to have filled, they can go to. That's not going to cost them any money, and they definitely see the real value in that.
Well, that's great. Question for me was, I think the question was about the e-visits and the telehealth that we do, and do we use an app for that? There's a number I'm not sure from a disclosure statement if I can name names, but there are a number of secure mobile communication apps designed for DPC or for healthcare. We can talk about it if someone wants to stop me afterwards, but that's what we use. So one of the things that we did when we did that initial intake on site, I gave everybody their login and signed them up for the app, so they had that ready to go. And so they were able to use that to communicate with us back and forth. And then a lot of the EHRs have patient portals as well that can be used to message securely. So that's how we handle those things. So it isn't just random text messages or emails, but we actually do use a secure mobile app to do that. So it's an interesting question is how do you manage the physician-patient-employer triangle, especially terminations? And so I will say, just because you've had a little bit of employee turnover, and so over the almost a year that we've been working together, you've had a couple employees leave that we've had to essentially disenroll. And I'll tell you from our side, what has happened is we have then contacted that patient just to say, I know you've left Banks and Brower, but if you were wanting to continue with us, we're more than welcome to still see you as a patient. So that's how we kind of handle things on our end. I don't know if it's any different on your end or if that comes into play.
Yeah, and honestly, I can't say that, in thinking back through the couple of employees we've had leave, it hasn't been an issue. Nobody's come to us and said, hey, what about this, or why not this? I think you guys have handled it, and we've not gotten any feedback at all, negative or positive, and in terms of that transition.
Yep, and I think the other thing that I'll point, just for the employees that you do have, we obviously are very HIPAA compliant. So when we talk, we never talk about individual patients or utilizations or any medical conditions. Now, if you are hearing it from your employees themselves, that's on you. But as we talk, so I don't ever kind of talk about that. So I think as patients come to see me, they're fairly comfortable knowing that I'm not actually going to share any medical information back to you. That clearly would be a big violation, so we don't ever do that. So.
And I can reaffirm that. As I said earlier, I had no idea my employees were using it, with the exception of one who's suffered a bit of an acute injury. Everybody can physically see she's been injured, so they all know that she's under care right now. But I didn't know. I was surprised when I asked, just, hey, how would you rank the service? That literally, I think every one of them had used it. So.
Yep. So I think you've answered a couple of these. So do you cover insurance premiums for your employees or just the DPC membership fee? So you do offer that reimbursement to some degree through the Gravy platform to cover insurance.
The way the Gravy works is it lets the employer set how much they will reimburse. You can set it at whatever level you want. We've picked $300 per an employee, and for our younger employees, it tends to cover, they're pretty much covered across the board. They're carrying a high deductible plan, at least for themselves individually. With the DPC, they're pretty much covered top to bottom. Some of our older employees are paying something additional than $300 a month, but it's still a pretty significant decrease in their overall bill.
Sure. This might be more a logistic question. Are you obligated to care for all employees, even if one isn't a good fit for the practice? So what we've done is we obviously will care for all the employees that you've enrolled with us, but it sounds like there may be some employees that you haven't enrolled with us because they, again, have already wanted to, they decided they probably weren't going to come see me anyway. So.
Yeah, and that's I know of one, there may be two, I'm not sure, but I don't know what happens if you don't like one of them. I'm not sure how that works.
Yeah, that definitely, I think we've talked about other, how do you fire, quote unquote, a patient? I think a lot of it is just re-education, and fortunately we don't have any issues with your employees, but I think if you have somebody that may be taking advantage of the office or might be drug seeking, God forbid, something like that, there definitely are ways that we can help that patient, short of saying that they can no longer be seen at our office. I do know prior to opening this office, I had worked for one of the larger employer-based health groups, and they actually did have in their contract that, so this was like with the city of Indianapolis and the clinics that they have access to, they do have that even though you're an employee and you have eligibility and benefits to go there, if you abuse that, they will terminate you at that clinic and you will no longer be eligible to go there. So there is some mechanism to do that. At the end of the day, it's a physician and a patient relationship, and if that's not working, I'm not going to keep seeing them just because you're covering their fees. So we do have that in place. One question about how do we handle the family members. So we do, in our pricing structure, do have family discounts. And so what we would do, we have all of your employees covered through you. If a family member wanted to sign up, I would offer the family discount to that family member or spouse or child or whatnot. So that is kind of an advantage of that initial person that's covered by the employer would be considered the first patient. And then our employee discount would then apply beyond that, or sorry, our family discount would apply for any additional family members beyond that. So this one might be for you a little bit. Any tips on the small employer who is torn between the smart financial deal, that is DPC, versus forcing his or her employer to switch docs? In my area, I'm the only one doing DPC, so getting the option to keep your doc is just not yet there in their world. So, yeah,
I mean, I think the better perspective to look at it is if you were doing what we were doing, which was to offer nothing, and that employee had nothing, we're giving them an option, and they can opt in or opt out. They don't have to take it. But if they had nothing, and this is something where you have access to a physician that's not going to cost you any personal money, but you want to continue to see the same doctor you're seeing, you're going to be in the same situation you were in before we offered it. So I don't see the downside to that. Where I could see a problem would be if you were offering full health insurance and then scaled back to something like this where they were able to choose their own doctor. I could see where that obviously would cause some consternation. I think, though, that there's a pretty decent probability as healthcare costs continue to rise that you'll probably see more small businesses, especially that fall under the 50 employee threshold, start choosing alternatives like this and looking at those things, because it's you can cover your entire staff under one of these type of programs for what it might cost to insure your staff and their whole family for just one member. So the benefit to the employer is huge, and to the employee, I think it's there too. But if we had been offering full insurance and changed this, I could see that would be a situation where maybe the employee might be a little bit more concentrated. But in our situation where we weren't offering anything, it was seen as nothing but a positive.
Okay. There's a question about how does the financial relationship work. So you pay us directly, so it's not a reimbursement through the employee. So that's how we've handled that. There are a number of ways to handle that transaction, but that's how we've chosen to do it. So the money that goes into your gravy really is for that patient to then go get benefits outside of our office. And so there's a question for myself. What has been the most successful way that you've been able to pitch DPC to small businesses? Do you just show up on site? So we don't just cold call. We don't just show up on site. So typically, there's been some type of introduction. So whether you had kind of found us through the article that we had in the paper, maybe it's a chamber event. There's some type of introduction of, hey, I want to get more information. I think you've sent a couple colleagues that have called us, and we've emailed and talked on the phone. But typically, what I do, if I go back to, I don't know if I can go backwards on this. Let's see. I think I can. If I go back to this list of what are the benefits that my practice would have to your employer, these are the things that I try to highlight. So again, if you're trying to offer some type of benefits, saying that we can have a full comprehensive primary care at a fixed cost, we're trying to reduce the employee absenteeism, could we do some on-site, or if there are special needs, those are things that I really try to highlight to show the value of what we can offer to that employer. And I think, as a business owner, I think you're always looking for those things as well. If I'm going to spend X amount of dollars per month on my employees, what's the value that I'm getting back? So, I think sometimes just the value of having a great primary care doctor is value enough. But for a business owner, you may have that's an intangible value. So I try to show some of the tangible things, and that's had varying levels of success. But I think we're starting to see that pick up a little bit as we move forward. So I don't know if there's anything else that kind of sold you on the deal, or else that you think.
Yeah, of. We after we looked into it, we literally sort of had a little office meeting with all of our employees and explained what the program was, and sort of took a straw poll. Is this something you guys would be interested in or not? And with the exception of the one employee who didn't enroll because she has full insurance and was happy with her current care, everybody was excited about it. And so I really think for those of you that are looking at doing this or looking at trying to grow, I think once you get in front of the people and they just understand what it is, because it's like my business. You throw out acronyms like DPC and nobody has any idea what that means outside of your world. Getting the word out there and explaining what it is and how it can benefit your employees. I think also there's probably a misperception amongst business owners as to how expensive it is. I think that we looked at a few different options when we were signing up, and the cost difference wasn't substantial between all the options we looked at. And quite honestly, we went with Dr. Patel because of my previous knowledge with him, and his office location was good for us too. But it was as an employer, it sort of became a no-brainer in terms of what we could offer as a benefit for what the expense was.
Well, great. One last question here was just on the timing. How long did it take to go from the first pitch to actually offering the DPC? I think it was probably about 2 months or so. That sounds about right. I actually came and met with you and your employees first before we had signed up. and then we kind of went through the deals and kind of got everything set up. So I think about a 2-month process. And that's going to vary by person. You know, somebody who maybe isn't as knowledgeable or doesn't quite know much about DPC, it may take longer to sell them on the concept. But then once you kind of are initiating the process, it can be very quick, just a month or 2 to get everything rolling. So.
Yeah, and I think most of the delay was probably on our part for being busy and not responding as quickly as we could have been. But I think most of the 2 months was getting it set up. We were pretty well sold on it right away.
Yep. Well, I think Bethany's given us that look. So if you have any other questions, we'll be up here for a few more minutes, and we appreciate your attention.